Bunion surgery is one of my focuses lately. Traditional bunion surgery has been fraught with some complications and recurrence rate, but I'm lucky enough to have been trained recently by a group of surgeons in Europe to the new minimal incision technique. And that allows us to do bunion surgery on individuals through a 1 millimeter incision, 3 of those placed specifically on the foot. It allows the patient to get back to recovery a lot quicker, back to shoes a lot faster, and it doesn't have the same scar tissue, so the motion is better.
So this program that you went through and that they're doing over in Europe, tell us a little bit more about how that compared with the old way of doing things, or the way some people are still doing things.
Sure. The open procedure requires about a 7 to 10 centimeter incision, which requires a lot of healing. The bone is cut and moved over and fixed with a screw, and then the joint is opened at the same time. So we have to wait for all those structures to heal and heal appropriately in order for us to get better range of motion, which requires the patient to be either in some casts or some boots or even immobilized for a long period of time. The minimal incision approach is done through 1 millimeter incisions. We shift it over through a small little cut of a special drill that only cuts bone and not tissue, and it allows us to fixate it so they can continue to walk in a shoe and not be in a cast.
I know that a lot of people that have bunions are embarrassed by them. They don't really want to walk around barefooted. If they were coming to see you or another podiatrist that does the minimally invasive surgery, how long typically are they meeting with you, waiting for their operation, and then back out on the beach?
Okay. So the consultation is fairly extensive because we dig into a lot of medical issues and make sure they're ready and make sure they qualify for the minimal incision surgery. But once we figure out that they're a good candidate, because not every patient can have the MIS, minimal incision approach, it's usually about a month, 3 weeks to a month to get on the schedule. And then they can get onto the beach barefoot in about 6 weeks. You know, getting into a shoe sometimes with the swelling is a little bit more challenging. So believe it or not, it's better to have the surgery closer to the spring or summertime when you can wear sandals or go barefoot and you don't have to squeeze it into a winter boot. So we have a faster recovery for those in those seasons than we do in the wintertime.
So this here is
we call it the minimal invasive foot surgery, or MICA.
Okay.
Mm-hmm. That's how we make our small little incision and we clear the tissue away from the bone before we cut it. We'll then put this special tool in to cut the bone on 2 different directions. This is all done blind, and we do it under fluoroscopy so we can see it on x-ray. Once we cut the bone, we're able to shift it over, and that's how we correct the bunion. We actually shift it over and then put 2 screws in it. Those screws are put through small little 1 centimeter incisions, so again, there's no large dissection. 1 large screw goes in first, and then we follow it with a smaller screw. These are guide wires, so it allows us to get the right position while we're doing this under x-ray fluoroscopy. Once we have it positioned, we'll remove the remaining ledge of bone that now is left over from the shift. And now you'll see that the toe is straight and the bunion's aligned. If the toe has any little angle to it at the end, we make another stab incision up by the big toe itself, clear the tissue off the side, and then put the burr in again. And move. We take like a pizza pie wedge out of the bone to angle it towards the inside of the foot, and that actually straightens the toe and gets it away from the second toe. A guide wire is put in again, and then we put a screw in to hold that in place. These are the screws that allow you to walk immediately after surgery, so you don't need a cast, a boot, or any kind of immobilization device except a shoe.
Well, that's pretty amazing. Thank you for going through that. And it's got to be great for you to be able to do that for the patients, to let them know that, hey, you're going to be up and around a lot faster than you would have been 10, 15, 20 years ago.
A minimal incision bunion surgery and minimal incision foot surgery in general is one of the greatest things that we're seeing come out in decades. It was attempted back in the 1990s, but the technique wasn't perfected yet, and there was a lot of complications associated with it. We're lucky enough that the Europeans decided to dig into it again. They have perfected it, and now they taught us in the United States. And I'm kind of blessed that I get to travel around the United States and teach other physicians on how to do this procedure.
Now, you said there are some people that may not qualify. Are there any of those folks that may be watching that would know right away that you know, unfortunately, I may not qualify for this, or do you have to see them and really kind of talk to them and look at it?
Yeah, it has to be looked at, felt. It's a matter of the stiffness of the joint, whether there's arthritis present. It's a matter of whether the bunion is too large to be corrected that way. I don't think the patient themselves can figure that out, but the physician can.
And you said this takes probably by the time you get ready and do all that you have to do, it takes longer than 20 minutes. But the video we just saw and the actual surgery takes around, did I hear 20 minutes? Is that correct?
Correct. For the patient, it's a whole different story. They have to come in preoperatively, and then we got to get them on the operating table and the anesthesia. But the actual time from the first incision to the time that we're done with the bandage is 20 minutes.
Unbelievable. So what are the, if there are any side effects, what are some of the biggest side effects people have to deal with, besides maybe a little bit of pain, obviously, because you're going in there and you're doing some cutting, but not nearly the cuts that used to be done?
Correct. We're definitely finding less pain at the time of this surgery. An open procedure can give pain scores at around 8 out of 10, and we're seeing them more in the 4 to 5 the first week, and definitely around 2 to 4 by the end of the second week. One of the things you have to worry about with MIS surgery is because we don't have a big, large incision, bleeding can be in the closed space, so you have to do a lot of elevation and a lot of ice for the first 5 days. And since the pain scores are a little lower, patients sometimes get a little carried away thinking they can do anything they want, and then they start to have a lot of swelling. So we really work hard on training the patient for the first 5 days to take it easy, ice elevate, stay off the foot, and then after that, they can pretty much hit the ground running.